Okay, this lecture is going to be a continuation of chapter 35 from the book, The Medical Reformation and Renaissance Bible by me, Pete Rogers. We're on page 514, so 514. Okay, so we're going to start off by talking about some basic blood physiology. And I can tell you, I've never in my whole life ever met a physician who knows this. Never a medical student, resident, or attending physician who knows this, and it's really basic. And it's been known for a long time. Red blood cells have a negative charge on their outer surface called the zeta potential, and that negative charge enables the red blood cells to repel each other, which is what you want, so they don't stick together. In the movies, you see somebody dies from bleeding. In real life, hardly anybody dies from bleeding. Almost everybody dies from blood clots. Clot in the heart is a myocardial infarction, heart attack. Clot in the brain is a stroke. Clot in the artery is a Johnson pudendal, that's impotence. Okay, it's a major problem. So anyways, the arterial wall also has its own zeta potential, so red blood cells don't stick to it normally. All right, typical red blood cells about 7 microns. Typical capillaries about 5 microns in diameter. So the red blood cells have to fold back on themselves a little bit to pass through the capillary. You can also get bridging molecules, things that are positively charged and a big enough size that they stick the red blood cells together. So instead of pushing this thin blood through like pushing water, the purpose of blood pressure is to get blood to the top of your brain, your cerebral cortex. You have to pump against gravity. That's what sets your pressure. So what I'm saying is if you're pumping normal blood, it's like water, very thin, low viscosity. You don't need a lot of pressure to get it up to the brain, let's say 110/70. But if you're pumping thick blood, because it's all stuck together, it's like a milkshake, and that can be done with chylomicrons or LDL cholesterol from eating high-fat meals. That can occur from fibrinogen being elevated in the blood from psychological stress, uric acid from eating excessive amounts of high fructose corn syrup, sodium from vasoconstriction of the peripheral vascular system. All of these things will cause your blood pressure to go up because you're pumping thick blood and with the sodium through a vasoconstricted, narrowed system. Okay. That's also why red blood cells have to be flexible so they can deform back on themselves to pass through these capillaries. And the relevance is red blood cells typically live about 120 days, about 3 months. And they become stiffer as more time goes by. They become stiffer because they get glycated, having like sugars bound to them, advanced glycation end products. We talked about that in the context of diabetes, in the context of eating meat, high fat, high protein foods, especially have high AGEs. Like nuts have relatively high AGEs for a plant food. It's another reason why I don't eat nuts. I don't recommend nuts. So anyways, let's see, what else? Oh, the other thing that you need to know if you want to be intelligent about atherosclerosis, that atherosclerosis is a blood clot. Okay, that's an important thing to understand. Atherosclerosis is a blood clot. Okay, I did a fellowship in interventional radiology, imaging-guided surgery at Harvard with the emphasis on vascular disease. And I can tell you, I used to think the cardiologists, the vascular surgeons, the cardiothoracic surgeons, and the vascular interventionalists like myself were the true experts of atherosclerosis, but it's actually the pathologists because they're the ones who look at it under a microscope, and they have no agenda. They don't care about stenting or anything else. They just want to, I gotta close this. They just want to figure out what's going on. And they look under a microscope and they go, it's a blood clot, okay? The guy who did the best work in atherosclerosis is Gregory Sloop. He wrote a great book about atherosclerosis. If you're real serious about learning atherosclerosis, I made some videos about him, but I would recommend that you read his book. It's very good. Okay, we're going to continue to talk a little bit more about atherosclerosis here. Just because atherosclerosis, blocking the arteries that feed a tissue leads to hypoxia, lack of oxygen being delivered to that tissue. And then when you have lack of oxygen delivered to that tissue, that can injure mitochondria and cause cells to transform into cancer. That's the Warburg effect. Okay, so normal blood pressure, let's say something like 110/70. Pulse pressure is you subtract from the upper number systolic, the contraction number, to the relaxation number, the diastolic, and that's your pulse pressure. So the bigger the pulse pressure, it's bad, okay? Like when you get a real high blood pressure of 200/100, that higher pressure, the systolic during left ventricle contraction, that leads to blood pressure that's real high and it hits against the arterial wall and it damages them. They have a damage response, and where they try to protect themselves, they'll get hypertrophy of the smooth muscles, hypertrophy of some collagen in the arterial wall, and like scar tissue, and it'll also lead to abnormal flow patterns that cause clotting, meaning it causes atherosclerosis. It's the main risk factor for atherosclerosis, by the way. Okay, the best way to prevent hypertension is a low-fat, low-sodium, whole food, 100% vegan diet. plants are full of all the good stuff. They're full of potassium and magnesium. Those are vasodilators. Okay, if you don't add sodium, then that diet will be low in sodium. And they also got nitrates, the precursors to make systemic nitric oxide. Okay, here's an example of a bridging molecule, the LDL cholesterol. It's big enough in size and positively charged to stick to red blood cells together, like I showed you on a couple slides ago. And so then the red blood cells being stuck together, the blood is thicker, higher viscosity. So you have to pump a higher pressure. Okay. Okay, here's a picture showing the zeta potential concept. And they've known this for a long time. They had to know this for storing blood. Okay, so, and you can give an anticoagulant that keeps them separated. All right, so anyways, here is the two red blood cells with a negative charge, so they repel each other. Here's the bridging molecule. Examples are IgM antibody. That's why with an acute infection, you're more prone to forming clots, okay? Like I recently had a patient who had pyelonephritis, an infection of the kidney, and they thrombosed the renal vein, okay? Also, you can get thrombosis when you have stasis. You know, that's the old thing. You can get a blood clot in your leg if you sit on an airplane for a long plane flight, 7 hours and don't go to the bathroom. That used to be the old joke. Be well hydrated when you go on a long plane flight, so you have to stand up and walk and go to the bathroom. If you're just sitting there, you get stasis of flow, and that can increase your risk of forming a clot, a blood clot. Other things that can do it, LDL cholesterol, we talked about that, elevated chylomicrons. Fibrinogen is elevated with acute psychological stress, with caffeine, because it mimics acute stress response, with sleep deprivation, mimics acute stress response, uric acid, let's say if you're eating a lot of high fructose corn syrup. I gave previous lectures on the metabolism of fructose. Okay, let's see, that's a key point. We talked about the arterial wall having that too. Where does the zeta potential come from? Where does the zeta potential come from? It comes from a couple things. It comes from cholesterol sulfates as part of the glycocalyx. It comes from heparin sulfate as part of the glycocalyx. Sulfates have a lot of negative charge to them. And on the end of the glycosaminoglycans on the glycocalyx, you've got sialic acid, which is like a glucose with a carboxylic acid to it. That's an oversimplification, but that's basically what's relevant to know. Okay, next slide here is just a little bit about normal blood flow. Normal blood flow is like laminar. You can think of it as being like your hand. The red blood cells are in the center. The white blood cells are right next to the WBCs. And then on the outer part is the plasma, like where my thumbs are. And that's just, with the proteins in it. And the plasma proteins would be like albumin, like immunoglobulins, fibrinogen, that sort of thing. Complement proteins from the immune system. Okay, and normally it should be laminar. With this sort of a parabolic velocity profile. And that's what the endothelial cells expect, the arterial lining cells of your arterial wall. And the relevance is when the blood flow comes up, I kind of inadvertently caused, when I moved around too much, the camera went out of focus. Maybe if I do this, sometimes it'll come back into focus. Sometimes not. Okay, but you don't really need to see me in focus too well. Sorry about that. When the blood flow comes up here, it hits the divider between the bifurcation. So let's say this is the internal carotid artery, goes up to your brain. Here's the external carotid artery, goes up to your face. I showed you before the hand trick, okay, right? You got your thumb is like the internal carotid going up to your brain, and your fingers are like the multiple branches of the external carotid going up to your face. Anyways, when the pressure comes up, it hits the median divider of tissue between the branch points, external and internal carotid artery. And then it bounces off of that with some turbulent flow and some retrograde flow called eddy currents. And the point I'm making is the higher the pressure, the faster the systolic velocity of flow is, the harder it hits against that median divider of soft tissue, and the more turbulent flow you get, the more eddy currents. These eddy currents are very slow, and as they come back slow, they confuse the endothelium. It senses this abnormal blood flow as a vascular injury. So it sheds its antithrombotic glycocalyx, things like antithrombin 3 and some of the heparin sulfates and whatnot. And that makes and it starts to express prothrombotic molecules on its cell surface, the endothelium, the arterial lining cells, things like VCAM, vascular cell adhesion molecule. And then you can get blood cells sticking to that, okay? And you can get a little blood clot. And then you end up in a steady state. Blood clot formation, blood clot dissolution, formation, dissolution. And it'll stay the same for years. It'll stay the same even for decades. I've seen that tons of times. I've looked at thousands of CT angiograms, the arteries of the neck and the brain. But as a person gets older, they start making less nitric oxide, and they're more vulnerable to forming an enlarging clot, an enlarging thrombus. Thrombus and clot means the same thing. And a little piece of it can break off and go to the brain and cause a stroke. And by the way, you can't tell the difference between an atherosclerotic plaque and a blood clot on a CT angiogram because they're the same thing. Okay. Anything that causes clotting causes more atherosclerosis. And that's why the same people who got risk factors for atherosclerosis also have more risk factors for blood clots. So here's an endothelial cell. This is the lining cells of an artery. Most important thing to know about them is that they produce nitric oxide. Nitric oxide is a gas. It diffuses into the lumen, the center part of the vessel, the center, and it'll cause inhibition of platelets from clotting. That's a good thing. That's what you want. You don't want clots forming. It'll also diffuse into the wall of the artery, and it'll cause the vascular smooth muscle cells to dilate. That's what you want. Open arteries with no clotting. That's what keeps you healthy. As William Osler, the great internal medicine doctor of around 1920 said, he says, a man is only as young as his arteries. Okay, your arteries are one of the main things that determines your health. So then this is a little bit like internal medicine thinking. If you've got happy arteries, you got a happy health. Okay. A little bit like happy wife, happy life. And, I would extend to that. And from what I've talked about with mitochondria and brain health, you want happy mitochondria too. But for the point of view of the arteries, you want good nitric oxide production. And Caldwell Esselstyn really emphasizes this a lot. And he's got the best results of any doctor in the world for his cardiovascular atherosclerosis patients. Okay. So that's the main thing, like I said too, you have heparin sulfate, glycosaminoglycans as part of your glycocalyx, sugar coating, if you will, on the wall of an artery, and you'll have antithrombin 3. This would be generating a negative endothelial cell zeta potential, okay? That's a normal endothelial cell. Now this endothelial cell gets confused when there's abnormal flow, and it'll shed some of this antithrombotic stuff, okay? And then it'll express prothrombotic molecules and be more prone to clotting. Glycocalyx, glyco means sugar, calyx means coating. So the molecules that stick up from the surface of the endothelial cells and from other cells is called a glycocalyx. Okay, here's a picture of endothelial cells showing that they have a spindle cell shape and it's orientated in the direction of blood flow. And they've got little cilia-like projections that sense the blood flow. So if the blood flow is going in the normal direction as they expect with a laminar velocity profile, parabolic velocity profile, that's all normal. So they keep on releasing nitric oxide. Everything is good. Everything is copacetic. They're happy. Things are cool. Okay? But when they get excessive hypertension and you get all this crazy turbulent flow and retrograde eddy flow, they go, what's going on? Okay, we better be ready to clot in case there's an injury to the artery so we don't bleed to death, okay? Because our ancestors worried about bleeding more than we do. We talk about stress as being chased by a tiger in the dark. Well, if a tiger claws you, you're going to bleed, or some other big cat bites you, you're going to bleed. So you got to be ready to clot. And our body is designed based on what our ancestors experienced thousands of years ago. Okay, here's a picture of an arterial bifurcation. And then you might be asking yourself, why did I go into all this stuff about atherosclerosis? And because atherosclerosis causes cancer. Just like we talked about Papua New Guinea, where they ate tons of sweet potatoes, 93% of their calories from sweet potatoes. So sweet potatoes is only 1% of their calories from fat. So it's a super low-fat diet. Even though they smoke like chimneys, more than the Americans had over 6 times more lung cancer than the Papua New Guinea population. Because this high-fat diets contribute to ischemia, lack of oxygen delivery to the tissues. Okay, that's a real important point. All right, so here's what I wanted to show you. So here's a lung cancer, right? And now here's a blood flow, a blood vessel, just a sample. Here would be the parabolic velocity profile with RBCs in the center, WBCs here, and then there would be plasma just adjacent to it. These little green things sticking up are part of the endothelial glycocalyx. So the cells lining the artery are endothelial cells. This is an artery taken from the lung. And like I was saying, when it comes under high pressure, it hits the median divider, bounces off of there with turbulent flow. Some of it's slow retrograde eddy flow. These little glycocalyx antithrombotic molecules are shed, and now the little tiny brown molecules there along the endothelium, those are the prothrombotic ones. They are sitting there exposed. Okay. So you're thinking to yourself, why am I repeating myself? I just told you all about this. This is prothrombotic. This increases cancer risk because you're going to develop atherosclerosis and make the adjacent tissue potentially relatively hypoxia. Well, there's another reason I'm showing you this, because metastasizing cancer cells are more prone to sticking to the endothelium. So that same sticky endothelium that predisposes to blood clotting, predisposes to white blood cells, binding to it, potentially increasing inflammation, it also increases cancer spread. So you can get more cancer metastatic tumor spread. So here's a cancer cell floating along in the blood, and it can now bind to the endothelial cell because the antithrombotic zeta potential that repelled all other cells is now gone. It's been shed because of the abnormal flow. And so now the cancer cell can grab onto the endothelium and potentially attach to it and move subendothelial and metastasize to the lung. So what am I trying to say here? Do you get the point? The point is the same things that minimize your risk of atherosclerosis, thus minimizing your risk, minimize your risk of hypertension, minimize your risk of atherosclerosis. They also lower your risk of metastatic cancer spread. That's what's so great about it, and that's one of the things why I was so amazed and impressed by this vegan diet. When I was a young guy, I was a macho man wrestler, okay? I thought vegans were, scumbag, hippie, sandal-wearing, pot-smoking, long-haired freaks. I would have had zero respect for the idea of vegan diet. But as I got older and I saw all these sick patients, and I'm like, well, what can we do to help these poor, pathetic people? And myself, I got fat for a while in my sort of early to mid 30s, and then I learned all about this, and I'm like, wow, there's something that people can actually do. All right, so anyways, that's where that all comes from. So we'll stop here on this page right here. This is page 525, and we'll continue with this next time. Hope that was helpful.